dysfunction, and this is in men and women both. It's
Hmm.
not just male centric. You've got to get an increase in blood flow to the sex organs in both men and women to get an increase in pressure. To get an increase in blood flow, you've got to make nitric oxide to dilate the blood vessels to get the engorgement. If your body can't make nitric oxide, you don't get the engorgement and you fail, both in becoming anorgasmic women and men with erectile dysfunction. So that's number one. That's what we call the canary in the coal mine. Because if you've lost the regulation of blood flow to the pelvic region, you've lost regulation of blood flow to the myocardium, to the coronary arteries, to the cerebral arteries. So you'll start to get your blood pressure will go up, is probably the second symptom. Because when you lose the ability to make the primary vasodilator, the regulator of blood pressure, your blood pressure goes up. And then people will start to get some dementia, mild cognitive disorders, because when you are calling on your brain to do a certain function,
Hmm.
you have to improve blood flow there. And without regulation of blood flow, you lose memory, you can't recall things, you don't perform cognitively as you did. You become exercise intolerant because you can't increase blood flow to working skeletal muscles or to the working heart muscle. It's basic, and you have low energy because nitric oxide is what controls energy at the cellular level, the ATP at the level of the mitochondria. So everything that I see, all the sick people walking around all the time that have high blood pressure, ED, diabetes, walking around in brain fog, it's a nitric oxide problem. But yet the neurologist doesn't recognize it. The cardiologist doesn't recognize it. The urologist doesn't recognize it. It's a single disease.
Blood flow basically ties back into and is a component of all these diseases that you've mentioned. Viagra and their constituents basically are drugs that actually help elevate nitric oxide in the body, which is why you get the side effect of actually having an erection or increased blood flow.
Well, no, I think that's a misinterpretation. So the PD5 inhibitors like Viagra, they work downstream of nitric oxide. So when
Mm,
nitric oxide is produced, it initiates another second messenger called cyclic GMP. And this is complex biochemistry, but I think it's important because it explains why 45% of the men that are given Viagra don't respond with better erections.
mm,
So you have to have some level of nitric oxide being produced in order for these drugs to work.
I
So what we're
see.
finding that is if you improve nitric oxide production in the corpus cavernosum or in the endothelial cells, and then you give PD5 inhibitors, then they improve with better erections. And then you can actually start to titrate down the doses to make them safe. But yeah, so nitric
Mm.
oxide turns the switch on, and drugs like Viagra keep it on. And that's the reason you're warned against the 4-hour erections, the flushing and the headaches and all the symptoms, all the side effects that you hear on these 45-second commercials.
So
But
you're saying
ED is
basically
really a
those drugs, you need the substrate, and people who are deficient and not making enough, for example, these drugs aren't going to work for them.
That's exactly right. You need nitric oxide for these drugs to work. Without nitric oxide, they do not work. So if you improve your nitric oxide, we think over time you can actually wean patients off the PD5 inhibitors. But
Uh,
as we're exposed over time, and the older we get, we're not most of us aren't getting better. Some of us are, and then the toxic environment a lot of people are exposed to. We damage our endothelium every day, and so I think we have to constantly try to improve and work hard to improve that.
You've given us strategies, lifestyle strategies such as diet and exercise to increase nitric oxide. We are to avoid things like mouthwash, like antacids, like antibiotics. Let's now move into the new realms of supplements and some of the exciting medications that are developing. And I'm really excited to hear about how you're using it to kind of treat COVID patients. But
Sure.
let's start, before we move into the drugs, there are certain, a lot of supplements that are out there. I wanted to know your thoughts. A lot of them are beet related, arginine, citrulline. What are your thoughts on those?
Well, some work. I would say 95% of them don't, just based on what we know now about nitric oxide biochemistry and physiology. About 12 years ago, we had these discoveries, and I think I've got more than 24 issued U.S. international patents. So we made discoveries in the nitric oxide field very early on, and then we commercialized these. So I've had supplements on the market for greater than 10 years. I won't mention those by name because it's not my intent. My intent is to educate you on the science so your listeners can make informed decisions. But I tell people, so the arginine citrulline products, typically don't work. There's never a condition of nitric oxide deficiency where we have too little arginine or citrulline. In fact, the problem is the engine that converts the arginine to nitric oxide is broken.
Mm.
Clinical studies show that if you give too much L-arginine to a patient with endothelial dysfunction, they actually get worse. So you have to be careful about arginine citrulline products. And then beetroot products, there's hundreds, certainly dozens, if not hundreds on the market now. I've tested every single nitric oxide product that's ever been put on the market. We have some sophisticated instrumentation where we can detect nitric oxide. We can put it on blood vessel strips to see if it's vasoactive and dilates blood vessels. Most beetroot products do nothing but turn your pee and poop bright red or bright pink. They do nothing in terms of nitric oxide. In fact, we use a lot of these as our placebos in our clinical trials. So what I tell people, if you're looking for a dietary supplement, look for patents. Patents on a box tell you that something innovative has been done there that nobody else can do. And then ask the manufacturer, the company, for published peer-reviewed clinical trials on that product, not an ingredient in the product, on the actual product. Clinical trials are expensive. Most dietary supplements don't work to hit their endpoints. But if you've got a product that works, that restores the normal structure and function of the body, you should be able to see meaningful endpoints in randomized placebo-controlled clinical trials. So those are two things I tell people. If you're looking for a dietary supplement, look for those. And then do some research on the company. Do some research on the inventor or the formulator. Have they even published in the nitric oxide literature? You know, I attend these webinars and you've got these talking heads, and I do a PubMed search and they've never published a single paper. There's 170,000 publications. And so this so-called nitric oxide expert has never even published a scientific paper in the field. So don't be fooled by creative marketing. You know, educate yourself. Science matters. Patents, clinical trials are critical.
So what do you have coming up on the pipeline? I know that you have something really exciting that's currently in phase 3 of clinical trials. And just so that I remember, phase 1 is really to make sure that, you know, it's safe to use. Phase 2 tells you that it's efficacious. And then phase 3 is really almost at the point where something's coming out to market. So you guys have made, you know, quite a few strides. So tell us about this product.
You know, getting into academic research, you know, my whole kind of mission was to make discoveries that would impact mankind. So several years ago, I started a biotech company with the intent of developing nitric oxide drugs, not dietary supplements, which are not meant to cure, treat, prevent, or mitigate any disease, but a drug that you could actually get. You as a physician have a patient, you could write a prescription for them, send them to the pharmacy, and treat a specific condition. We were working on things like ischemic heart disease, heart failure, pulmonary hypertension, really some unmet medical needs that aren't well managed with current medications. And we know that nitric oxide is important. And so we were on that path. And I'll tell you, it usually takes about 10 years and $800 million to get a drug to market. From the time you make the discovery, go through all the FDA filings, phase 1, phase 2, phase 3, phase 4. And then comes COVID. And so with this current administration, they created this coronavirus treatment acceleration program. So we were able to file an IND, which is an investigational new drug application, to get approval from the FDA to use our nitric oxide drug technology in COVID patients. And this was very important to us because at that time, back in March or April, it was recognized early on that people who had high blood pressure, diabetes, smokers, kidney injury, pulmonary hypertension, or obese were the ones who did the worst. They had about a higher rate of infection, higher rate of hospitalization, and in some cases about a 10-time higher mortality. And so now we know, we're 10 months later, 11 months later, everything we know about COVID points to a nitric oxide deficiency. So I did mention before, part of our immune response is when we get infected with a virus or bacteria, our immune system mobilizes through regulation of blood flow, and then our macrophages, neutrophils, isolate that area, infected area, generate a lot of nitric oxide, and kill off the infection, whether it's bacterial or virus. And this was published back in 2005, that nitric oxide can inhibit coronavirus replication, 15 years ago. So people that are nitric oxide deficient can't elicit an immune response because they can't mobilize their blood cells. And then Everybody with the underlying conditions of high blood pressure, heart disease, kidney disease, they're systemically nitric oxide deficient. So if we were going to do a study in the general population, because most people recover from COVID very nicely, the susceptible typically do very poorly, and some people die, unfortunately. We would have to enroll about 80,000 people and we were looking to see if we could reduce hospitalization by 25%. We took the most susceptible, vulnerable population, that's the African American community. African Americans make up 13% of the US population, but they're accounting for almost 50% of the COVID deaths.
Yes.
And we know from a lot of epidemiological data to the biochemistry and physiology and genetics of the African Americans that the reason they have the normal health disparities, African Americans in normal times have higher rate of high blood pressure, diabetes, some cancers, kidney disease, and all that can be explained by accelerated rate of endothelial dysfunction and loss of nitric oxide. So it made perfect sense to me if we went into the African American population and we got our IND approved by the FDA to enroll 840 African American patients age 50 to 85 with at least one underlying condition, whether it's high blood pressure, diabetes, smokers, pulmonary disease, or respiratory disease, or a kidney disease. And then we get them within 72 hours of a positive test. Because as you know, in most diseases, you can reach a point of no return. So our objective was to catch these patients early. Let's implement therapy as soon as we can validate a positive corona. And then we follow them for 30 days. And the cool thing about this, Ken, is, as you may imagine, if you're in poor health and you've been diagnosed with COVID, especially African American, there's a lot of fear. And so we send these patients home with a pulse oximeter, a blood pressure cuff. We monitor their temperature. It connects to the Bluetooth so we can remotely monitor these patients. We have a coordinator call them 2 to 3 times a week just to follow up. And we're getting remarkable results. I mean, it's a double-blinded, placebo-controlled study, but when you see blood oxygen levels go from the mid-80s to the mid-90s in 10 minutes after taking their study medication, this is certainly not a placebo effect. This is what nitric oxide does. This is what nitric oxide is. And so I'm hopeful we'll have this study completed by hopefully mid-first quarter of 2021 and have a very safe and effective nitric oxide drug on the market for COVID. And let me just mention, you made a very good point, because we convinced the FDA through our filings that we had enough safety data that we could go straight into a 2B, 3A clinical study, which is specific for African Americans with COVID.
That's amazing. And you think the mechanism of action is a couple-fold. It sounds like initially you not only in the improvement of the blood flow, but you're suggesting that nitric oxide actually works with the immune system to eradicate the virus.
Well, it's working on multiple points here. It's antiviral, so the epithelial airway it has a lot of endothelial or nitric oxide synthase enzymes. So if you're infected, typically through the nasal cavity is where most people are infected, then our immune system isolates it, generates nitric oxide, prevents the viral replication, prevents progression of disease. Here's the other important thing. There's these so-called long haulers, people that have these collateral symptoms long after the active infection is gone. We know there's an increased blood clotting risk, blood clotting disorders, increased risk of heart attack, pulmonary, kidney disease that survive long after the infection is gone. And it's the cytokine storm, it's the inflammation. So one of my patents is on a method of reducing inflammation.
Mm-hmm.
So we employ this strategy to reduce the inflammation, mitigate the cytokine storm, and improve the endothelial function in these patients. So if you improve endothelial function, you can regulate blood flow, go wherever it needs to go, get the good stuff in, the bad stuff out, help the immune system fight its battles.
And what is the mechanism of action of this new medication?
Well, it's an orally disintegrating lozenge, because nitric oxide is a gas. It's not a pill you can swallow, because the chemistry would be much different in people that was taking an antacid versus those that don't. So we developed a lozenge that it takes about 5 to 6 minutes. You put it in your mouth, you move it around, it's almost like a sweet tart. And over those 5 to 6 minutes, this matrix falls apart and it generates about 40 parts per million nitric oxide gas. So it's absorbed in the oral cavity within about 30 seconds, you can start to see dilation of the carotids, an improvement in blood flow. Within 4 hours, we're seeing an improvement in endothelial dysfunction. The blood vessels become healthier. We've seen in earlier patients, pediatric patients with acute kidney injury, kidney function can be restored in a matter of days. It's pretty remarkable. It works on every system in the body, and that's what makes nitric oxide so important.
I would imagine this would lead to a breakthrough in its use in many other chronic diseases once it passes here.
Well, we have a long list of indications we're going after because there are a number. We have a sick population.
Yeah.
And most people are on multiple meds, some sick, some people are on dozens of medications, and they're still sick. May I explain why they're sick?
Yeah.
So I think if we get, in my philosophy in doing 20, 25 years of research, is understand the extent of disease that you can rationally design safe and effective therapeutics to get to the root cause. And that's exactly what this type of therapy does. It promotes nitric oxide production, reduces inflammation, oxidative stress, and immune dysfunction that occurs in every single chronic disease known to man.
That's amazing. Such great information today. And I love to see where this is all going. One of the major components as to why cells don't function very well is they're not getting the nutrients when you're not getting the blood flow. You're not getting the gases. You're not getting the other nutrients that are coming there. And so let's talk a little bit about nitrous oxide and how it works on blood flow.
So it's a vasodilator, meaning that when it's produced by the endothelial cells, those are the cells that line every blood vessel throughout the body, it triggers our smooth muscle that basically regulates smooth muscle tone or vascular tone. When nitric oxide is produced, the blood vessels open up. So then you get increased blood flow and delivery to the downstream tissue. But you made a good point. You have to get the good stuff in, but you also have to get the bad stuff out. And that's all dictated by regulation of blood flow. And nitric oxide does both. It gets the oxygen and nutrients to individual cells of the body. It regulates metabolism, mitochondrial function, and actually helps excrete the toxins from the body, whether it's through our lungs or through our kidneys or through our sweat glands.
Nitric oxide is naturally made in our bodies. A Nobel Prize was awarded for the discovery that nitric oxide plays a significant role in the cardiovascular system. This discovery revealed nitric oxide as a vasodilator, helping to reduce blood pressure and increase oxygen in the blood. Produced by the lining of the blood vessels, known as the endothelium, nitric oxide acts as a messenger molecule, telling blood vessels to widen or dilate, and contract or relax, like an elastic band. With enough nitric oxide, blood vessels can relax and widen, allowing blood to flow from and to the heart. As we age, we produce less nitric oxide. This can cause the cardiovascular system to become less elastic, which can reduce the flow of oxygenated blood to vital organs. This is the reason it's important to have an active lifestyle and a diet that's rich in nitrates, which bioconvert to nitric oxide and may help maintain normal blood pressure levels and a healthy cardiovascular system.
Life's greatest tragedy is that most people do not value their health until they lose it. Life's greatest tragedy is that most people do not value their health until they lose it.